Anyway, I'm going to talk about the AI antibody challenges, which were designed to really understand and advance how AI could be used in antibody discovery. But before we go there, I wanted to talk about something I published with Andreas Pluktham and over 100 other people 10 years ago. So what we proposed in this commentary was to standardize antibodies used in research. We pointed out that antibodies were the only reagents used in molecular biology that weren't molecularly defined. When you get an oligo, you know what it is. You get a plasmid, you know the sequence. You get an enzyme, you know what it is. But when you buy an antibody, what you're getting is usually a mixture of different things. And so what we proposed was to define antibodies by their sequences. In other words, this would increase reproducibility and consistency, and then produce them as defined recombinant proteins. So what's happened since then? Well, the idea of defining antibodies by their sequences, although I still think is scientifically correct and would be very valuable, has really fallen down because of commercial concerns. No company with good antibodies wants to share the sequence. It's not worth patenting. And so people are not sharing their sequences. However, what they are doing is producing antibodies as recombinant proteins. So even if you don't know exactly what it is, somebody else does. What else has changed in the last 10 years is that some in vitro antibody libraries are as good as or better than immunization methods. So for example, the platform we use at Specifica that we developed, we've been able to pull out antibody affinities of 9 picomolar directly without affinity maturation. Developability, over 80% of the antibodies coming out of our libraries have no biophysical liabilities. Diversity, we can get up to 1,000 different HCDR3 clusters against any target. And what comes straight out of these libraries is sequence defined and recombinant. And the sequences are routinely generated as part of our campaigns. And finally, these libraries are now competitively available to antibody reagent companies, either in the form of library transfers or as discovery campaigns. So I'm going to say a little bit about the platform because this is important in the sense that it's NGS datasets from the platform that we're using in the AI antibody competition. And so the way we designed the libraries, we started off with therapeutic antibodies. We figured that the large pharma companies had done all the work to make sure that they were well developable. And we took the most developable therapeutic antibodies out there. We chose them for different germline diversity. And we figured that this would result in a reduced developability risk. For all the CDRs except HCDR3, we use what's called natural replicated diversity. So these are real CDRs from our internal NGS datasets. So there's no artificial sequences. All the sequence liabilities have been purged. And again, we believe when combined with the super developable therapeutic scaffolds, we're getting a reduced developability risk. I'd also like to point out that all the CDRs, because they're human and they're matched to the germline genes, could occur as antibodies in any one of us. The HCDR3, because the diversity is so high, we use natural HCDR3 diversity from naive and memory cells. And what we use is we use 10 donors that are not used for anybody else. We have a vast diversity. We actually measure that diversity using next-gen sequencing, guarantee at least 100 million different unique HCDR3s. And when we're delivering libraries, these donor sets of 10 donors are exclusive to the partner. We don't use them for anybody else. The idea being that we want to minimize as much as possible the likelihood of two of our partner clients generating antibodies against the same target that are identical. We also find that this results in a very high affinity and diversity of binders. And then finally, the selection platform we use is phage and yeast. This allows complex selections to be done relatively straightforwardly, as I'll say a bit more later. Everything is in vitro, so we're eliminating the use of antibodies. And it's also much, much faster than immunization. So what does the antibody structure look like? And this is also important for the competition. So if you look at the light chain, what we have is VL frameworks all coming from the therapeutic scaffold, okay? The CDRs All these VLCDRs are from our human NGS database. They're purged to sequence liabilities, they're synthesized and germline matched. In case of the heavy chain, the same is true for frameworks 1 to 3 and HCDR 1 and 2, but HCDR 3 and 4 and framework 4 all come from the unique donors, 10 human donors by PCL. And then there's a linker in the middle. So I mentioned phage and yeast display. So the libraries we build have at least 10 to the 10 different transformants. And based on the next-gen sequencing we do, that's pretty close to the total diversity of the libraries. We use 10 to the 12, so trillion phage per selection. And we do a couple of rounds of phage. And the whole purpose of this is really just to bring the diversity down to about 10 to the 6, which is compatible with yeast display. And really it's in yeast display that we do the fine tuning of the affinities, the specificity, look for agonists or antagonists. And this is a very powerful technique that allows us to really get the antibodies we want. Usually we have enough diversity there to just do random clone picking that provide us with antibodies that do what they're required to do. But in some cases, when we need greater diversity, we do next-gen sequencing and further analysis. This increases the diversity, both in terms of the number of clusters available, as well as the depth of each individual cluster. So how does a library perform? So this is a number of campaigns done over the last few years. This dotted line here represents 1 nanomolar, so anything below this is a sub-nanomolar antibody. And essentially what you see that if we're excluding peptide MHC discovery campaigns, which aren't included here, about 70% of single-chain campaigns generate sub-nanomolar binders, and about 35% are actually provide at least 1 antibody, which is less than 100 picomolar. About 20% of the antibodies overall are sub-nanomolar, and the lower affinity antibodies tend to come from higher complexity selection. So the more selection gates you put on, usually the worse the affinity is. So does AI make in vitro platforms redundant? So this is what we were really trying to talk about. So the antibody challenge, what we were trying to understand, given all the hype that was out there, we wanted to understand what can AI really do? So how can it facilitate antibody discovery? So what we defined were 3 challenges based on 2 SARS-CoV-2 RBD NGS data sets. The first one is the NGS of a sorting output of an affinity maturation campaign that has diversity in all CDRs except HCDR3. And the second data set is an NGS data set of an HCDR3 clustered output selected against SARS-CoV-2 RBD. Given the uncertainty of the value of AI, we tried to make these challenges as easy as possible. So we figured that if we couldn't get if AI couldn't help us with these particular challenges, then it probably still had a long way to go. So the target was RBD, and this is the most studied protein in history. We were providing detailed NGS information, including abundance, enrichment, as well as the affinities of over 140 antibodies. Usually you don't get that much data when you're trying to do AI. This was loosely inspired by CASP, which was a protein structural prediction competition that happened once every couple of years and really allowed AlphaFold to demonstrate its power. We carried out this first competition ad hoc without really any sort of deep organizational structure apart from myself and Frank. Time was of the essence. We wanted to move quickly, learn what worked, what didn't, and then apply that to future challenges. Everything was carried out blinded, and we had an announcement publication in Nature Biotech at the beginning of November. We had a date when all NGS datasets were made available for downloading simultaneously by the participants. They had 14 days after downloading to upload their designed or identified antibody sequences. We will be publishing a results publication, which will be submitted with all the participants as co-authors. All the results are going to be published blinded, except for the winners. The reason we wanted to do this was to not embarrass anybody. And so we feared that people, if they knew they were going to be shamed, they may not participate, and so we wanted to eliminate the possibility. So every individual participant knows their rank within the spread, but they're not identified except the winners. We have partners that help us. So as I mentioned, Specifica provided the NGS datasets. The Azenta did antibody production, expression, and SEC characterization. We first did affinity characterization by Cartera, and then the higher affinity antibodies were further analyzed by Kinexa. That was done by Sapidine. The target was provided by Biotechne, and finally, developability assessments were carried out by Mosaic. And so the three challenges are indicated here. So the first one, given the NGS dataset of the sorting output of an affinity maturation campaign with diversity in 3 libraries, LCDR1 and 2, LCDR3 and HCDR1 and 2, generate sequences of 3 de novo designed antibodies with improved affinities. So this is an affinity maturation challenge. The second one, given the NGS datasets of HCDR3 cluster selection output, identify the sequences of one antibody within each of 3 different clusters that has the highest affinity. And finally, using the same dataset, generate the sequences of 3 de novo designed antibodies binding the same target that do not appear in the dataset. So all of these challenges actually have practical utility within antibody discovery. And so if any of these were really found to be very useful, they would also be clearly useful within the context of affinity maturation of antibody discovery. So we had 33 participants altogether. We had 1 large tech, big tech in China, and then 8 AI biotechs, 5 large biotech farmers, 10 non-profit academics, and 9 small medium biotechs. You look at the total number of submissions, there are 527 antibodies submitted. There were very few overlaps, although there were a few. We synthesized them all independently and then checked afterwards for the overlaps. They formed an internal control. This shows you the full data set, which is over 1,500 analyses. That's every antibody tested 3 times on the Cartera. And as you can see, there's a lot of work. So now, when you're looking at affinity, then ELISA is good down to about 10 nanomolar. SPR, either LSA or the Bicol, can give you good affinities from about 1 micromolar down to about 100 picomolar. Kinexa, however, is really powerful in that it can go from about 10 nanomolar all the way down to the femtomolar range. And so our plan was the Azenta produce the antibodies and ship them to Cartera for SPR and simultaneously to Mosaic to measure developability. They were rank ordered by SPR, and the poorly developable antibodies, including those on the borderline, were considered for Kinexa. Kinexa first did a single point screening to confirm consistent rank order. And then finally, standard Kinexa screening was carried out on up to 5 candidates with good developability. So how did we score the developability? We had 5 developability assays indicated on the left. So HIT retention time, BVP score, which is polyreactivity, AC signs, which is self-interaction, TM is melting temperature, and TAG is temperature at which aggregation occurs. And so there were a series of values below which for the first 3 and above which for the last 2, an antibody was considered passing, and for that they got a score of 0. At the other end of the extreme, there were also values where if the antibody had greater values in the first 3 or lower values in the last 2, it was considered a failing antibody and was given a score of 2. Between these 2 ranges, we would consider this to be questionable. We gave a rank of 1. And essentially to pass, an antibody had to have a score of 3 or less, and it failed if it had a score of 4 or more. So when we're looking at the rank order of correlation between standard Kinexa and SPR, one thing that was clear was there was a strong rank order correlation between the rank, as it were, of the antibodies between standard Kinexa and LSAR and SPR kinetics. However, there was a poor absolute correlation of the values, particularly at high affinities, with Kinexa generally giving much higher affinity values. There are a couple of outliers here, but on the whole, you can see that the affinities measured by Kinexa are all much, much lower than their corresponding affinities measured by SPR. And we use the Kinexa for high affinity antibodies. The same was true also for single point screening, correlation between single point screening Kinexa and SPR. Again, you see that there's a linear correlation, which is very strong rank order correlation, but there's a poor absolute correlation with the Kinexa giving affinities which were 5 to 10-fold better, higher. We use the single point screen to prioritize the top 5 antibodies for standard Kinexa because it requires a lot more work, again, with appropriate developability. And this shows the correlation between single points Kinexa to standard Kinexa. And as you can see, this is a very, very good correlation. So let's go to the challenges now. So as I mentioned, the first one is an in silico antibody affinity maturation challenge. The way we traditionally carry out affinity maturation, we have an antibody here of interest. And what we do is we provide a library of CDRs in L1 and L2, L3, and H1 and H2. These 3 libraries are all synthesized independently, and we select from each of these and until we get a good population of binders from each of these libraries, as illustrated here in this yeast FACS plot. Then what we normally do is we take the final outputs of these and we make a combination library where we have the best of the L1 plus L2, best of the L3, best of the H1, H2, and we repeat another selection campaign. And that usually gives us binders. We guarantee at least 10-fold improvement, but we've had improvement of as much as 20,000-fold. So the challenge was we provided these data sets corresponding to these 3 library outputs, and the AI had to predict antibodies using this information to get a higher affinity antibody without having to go through the experimental second step. So the advantage of this, if it was functional, would be that we would be able to generate high affinity antibodies 2 or 3 weeks faster than if you did this independently, right? If you did this experimentally. So these are the results. So this is SPR affinity here, as illustrated. This is the experimental affinities going in the combination library. These are the AI submissions. You can see there's a very, very large spread. And in fact, if this is the experimental, you see that most of the AI submissions are much worse than the experimental. However, this is the parental antibody, by the way. However, there are some AI submissions illustrated here and here, which do provide some extremely good antibodies. And when these antibodies were remeasured by Kinexa, this one had an affinity of 95 picomolar, and these were first. This one was 740 picomolar. This came third. So the ranking was consistent for SPR and Kinexa. We don't have a Kinexa result for the experimental, so these aren't directly, what's plotted is directly comparable. The affinities measured by Kinexa for the AI antibodies cannot be directly compared to the experimental. This just shows affinity maturation again. Here we've got the AI standard Kinexa. This is all the SPR values, AI SPR values. These are experimental only SPR, and these are all the winning submissions by single point Kinexa. So it's clear that here, for the winning submissions, these 3 here, so that's an AI biotech, small medium biotech, and a non-profit academic, and the small medium biotech at the end, all of these are providing antibodies that are as good as or better than the experimental, with the caveat that the experimental is measured using SPR, and these are here being measured using single point Kinexa. So that's challenge 1. Challenge 2. So here we have a selection output carried out against RBD. We cluster on the basis of the HCDL3. we have 3 clusters, 27F, 28F, and 47F, that have 3,500, 2,500, and 400 different sequences within them. And the goal of the challenge 2 was to identify the highest affinity antibody in each of these clusters. So going through these clusters one by one, so 27F. So here we have the experimental. So these were just randomly picked clones from the cluster. And these are the affinities of those measured by SPR. These are the affinities of all the antibodies identified by AI. So every single one of these antibodies is found in a cluster. It's a real antibody that had been selected. These are the ones that were tested, and these are the ones that AI identified as being worth testing. And one thing that's quite striking is that you see that the randomly picked are some of the best randomly picked are better than the best AI. And this is the performance of the different organizations. So a non-profit academic, you see here, came first. Non-profit academics actually were the first 3, and then there were some others further down. If we look at these at the picomolar at the Kinexa level, then the best affinity here was 9.2 to 10 picomolar by Kinexa. That was a non-profit, and these ones were 16 picomolar. These ones 2 were third together. The next one, many of the antibodies here were eliminated due to developability scores, or had to be reordered as a result of the Kinexa rank. So again, experimental, big spread here, but not very many antibodies. AI submissions essentially overlapping the experimental thread, most abundant here. And then you see the top 3 are 3 non-profit academics. These ones actually were confirmed. So these 2 are the first, had an affinity of about 100 picomolar. These were identical antibodies. Final one, cluster 47F. Again, experimental, AI. You see that the experimental on the whole are better than the AI identified sequences, although there's one here which is much better than the experimental. Again, non-profit academic did best here, followed by large biotech and AI biotech. And the affinities were measured. These ones were 50 and 100 picomolar. This was a tie for second place with 124 picomolar. And down here, also tied for second place, 100 picomolar. Now, challenge 3, and this was the one that I think most people were really interested in. So here we have a full NGS of a selection output of 30,000 sequences. We also provided the affinities of 144 antibodies. And the challenge was, given all this information, design high affinity antibodies not found in the NGS dataset. So this is the affinities of 144 antibodies measured by SPR. These are the AI submissions. And these are the affinities, again, by SPR as coming out of the competition. Now you can see that here, when measured by SPR, most of the experimentals tend to be better than the best AI. However, when we looked at Kinexa affinities, single point Kinexa, and this is including both the experimental and the AI, you can see that we're actually pulling out some extremely high affinity antibodies. The best one here is just under 3 picomolar. The best one here, as measured by Kinexa, is 9 picomolar. So the best affinity antibody here is 3-fold better than the best experimental. However, although this could not be eluted from the HIC column, so although it technically passed the developability criteria, because it only got 2 points, we do wonder how really developable it would have been. Antibodies in this one were disqualified because they had scores greater than 4 for developability. So that's the results of the competition. So what are the conclusions? Well, with high quality data sets, with extensive affinity and NGS information, challenge 1, generating an affinity improved antibody. I think it's fair to say that the best AI antibody is as good as the best experimental. However, most experimental antibodies are much better than most AI antibodies. If the best AI antibody algorithm is consistent, the use of this in affinity maturation would save 2 or 3 weeks. Challenge 2, identify the highest affinity antibody in a cluster. I think it's fair to say that AI was no better than random clone picking, in that sometimes it was better and most times it was worse. Challenge 3, de novo antibody design. Given extensive sequence information and 144 affinities. So this is 35,000 sequences recognizing a single target and the affinities of 144 of those antibodies. The best AI designed antibody was very high affinity, under 3 picomolar, 3 times better than the best experimental. However, as I mentioned, it doesn't elute from the hit column, so it's probably not clinically developable. I would say that given really good quality data sets and information, AI is generally better than the experimental here. Quite a few antibodies were disqualified for poor developability. I think it's important to say that the detail and volume of information that we've provided here in these data sets is not usually available until the end of a discovery campaign. Anyway, we're now already thinking about the next challenge. And I think what we're really most excited about is a bake-off between experimental and AI. So the idea is to announce a target. We'd like to participate this time, so we'd like to get somebody else to do that. To announce the target by an independent entity like the Antibody Society, and then provide 10 weeks to deliver sequences of 3 antibodies. And these can be derived using any method, in vivo, in vitro, or AI. And then we'd really see how AI compares in a de novo campaign against an unknown target when compared to immunization and in vitro libraries. Another one is to take a selection output at NGS discovery output and try and again identify highest affinity antibodies, this time without any affinity information, and finally identify antibodies binding different epitopes. This will be very important. And so acknowledgements, Specifica, it's myself and Frank that did the work, Zenta, Crystal Richardson and Laurie Turner, Cartera, Dan Bedinger, Kinexa, Liz Hopkins and her team with Ginger and Steve, Biotechne, Raymond Chan, and Mosaic Crystalline Graph. And with that, I'd like to thank you for your attention and goodbye.